Hello, doctor. Welcome to DC Conversations. Um, Tell us, heart diseases earlier was like people would get diagnosed post 60 and or probably after 50. But these days, it's no longer a older person's illness. Why do you think we are seeing such a rise in cases among younger Indians today? Youngsters, rather.
That's a very relevant question, and it has been discussed many times in the social medias and all that. The statistics regarding this is very concerning, actually. If you look around the world's data, we know that the number one killer disease is cardiovascular disease all over the world, but the status has changed in developed countries or in the West, where the incidence or prevalence of heart disease has kind of plateaued, but it's not the case in lower and middle income countries like ours, where the incidence is actually skyrocketing. And if you look at some real data, we have some studies pan India which shows that around 10% of adult population is likely to have coronary artery disease. And the sad part is, out of this, as you already told, unlike in earlier times where it was a disease of the elderly, nowadays this is seen in young people very often. Like some of the series are showing around 40% of all the people getting heart attacks in India are below 40 years of age, which is a very alarming statistics. And among these people, the rate of death is also quite high because people generally don't expect us to have a heart disease at that age, which
Yeah.
results in delays in recognition of the disease as well as getting treatment. So the mortality is also quite high. So as a nation, this is very concerning statistics regarding the heart disease in India. So it's there.
Also blood pressure among youngsters has led to an increase in heart-related deaths by 50%. I mean, by midlife, you see that youngsters are dying. Could you explain why hypertension is such a dangerous threat?
Uh, Speaking of not just hypertension, in general, if you look at the reason for why the heart diseases is getting more in younger people, so one of the reasons is the conventional risk factors like diabetes, hypertension, dyslipidemia. These things are on the rise in our younger generation people, mostly related to the lifestyle changes we are having. All these diabetes, hypertension, dyslipidemia, all these are called silent killers because initially when they are high, we don't have any symptoms. And later, when we develop some complications like a heart attack only, then we realize that we are having this. So unless we check it for it, we don't catch it in the early phases. So specifically coming to your question like hypertension, whether it causes an increased risk, definitely one among the risk factors, classical risk factors for heart disease is hypertension. And in multiple studies, it has been shown that in those people who have started hypertension, having hypertension above less than 35 years of age, they are almost at double the risk when compared to the general population for developing a heart disease in their middle age. So that is true. Now, why is it means all these classical risk factors like conventional risk factors like diabetes, hypertension, dyslipidemia, their habits like smoking, obesity, all these things have a cumulative effect. So for how long you are having it uncontrolled in your body, that kind of effects gets accumulated in your body, and not just heart attack, you are also more likely to get diseases like stroke and peripheral artery disease.
So many people believe that, these advanced treatments that are today available can fix heart problems if and when they arise. But why do you think prevention through lifestyle choices is just as critical as access to cutting edge treatments?
Yeah, definitely. That is beyond any doubt that we can treat any complexity of diseases many a times once you have it, but it's always better not to have it. That definitely is simple logic that you should always prevention is better than cure. There is no doubt regarding that. And one of the saddest thing about that is out of all the cardiovascular deaths that is occurring, studies have shown that more than 80% of these cardiovascular deaths are preventable. So when you talk about heart disease, which the factors causing heart disease, there are modifiable risk factors and non-modifiable risk factors. So around 80% of the cardiovascular disease burden and death is caused by this modifiable risk factors, and which include, as I already mentioned, diabetes, hypertension, dyslipidemia, smoking, obesity, inactivity. Then comes some recently more recognized, but not so conventional risk factors like the stress, air pollution, and all those things. And the non-modifiable risk factors will be your age, your male sex, your hereditary. Some families have CADs running in their generations. So all those things are not modifiable. When you talk about modifiable risk factors, all these things, that is diabetes, hypertension, dyslipidemia, you just have to have a culture of taking care of your own health, taking charge of your own health. So for that, first thing is you need to have the awareness that what all things is good health choices and bad health choices and what makes you ill more often. And you make your own choices based on that. So whether it is diet or exercise, most of the time the information is with us. The next thing is whether we are ready to act on. So unless we are readily uh, motivated to do this when we are not sick. So the prevention requires a lot of motivation. So first you have to be aware about the things. Second, you have to be very motivated about doing these things. And this has to be started from very young age. That is from the children regarding this, your diet and exercise and all that. This is very important prevention.
Also, you have non-invasive diagnostic tests these days. They're becoming more and more common, right? So, what tests do you recommend for someone who wants to proactively check for blocked arteries or probably check for early warning signs?
See, the question is very relevant, but one thing we should understand is for a person who is not having any disease and he is coming for a health checkup, the primary attention should be not given to checking whether he has a block in the artery, but the initial thing is what is his overall cardiovascular risk? What is his risk of getting a heart disease or peripheral artery disease in the coming next 10 years? There are multiple models now available for that, and based on that, only the treatment decisions are made. And also, a proper history and examination done by a trained medical personnel adds a lot of data to assess the risk of the person for developing a cardiovascular disease in the future. So that is one thing. Now, next thing, basic test for when pertaining to heart will be like getting an ECG, an echocardiogram done, and then comes the stress test, like the treadmill test. We have stress echocardiogram, stress nuclear position imaging. All those are non-invasive tests which gives an idea whether the person's heart is working properly, is there is a chance of blockage in their arteries. Then more recently, we have CT coronary calcium scoring, so where you get a CT scan done, and based on the calcium scoring, you can actually stratify the person's risk of having significant disease or not. And the final confirmatory thing comes from your invasive angiogram, where you have what percentage of block, whether it
Yeah.
requires treatment. This invasive angiogram is not routinely recommended for everybody. So the initial other non-invasive tests, there are a lot of, as I already mentioned, the stress tests, stress echo, perfusion scan, CT. And on top of that, we have some of the markers in the blood which can be tested, like lipoprotein Lp(a), your LDL levels, then your hsCRP. All these are pointers towards the inflammation in your body, which can result in having plaques in your blood vessels. So you take everything into total and you build the risk for an individual patient, and then you decide on what next to do.
So cardiology has advanced rapidly in the recent years. I mean, could you talk about some of the latest innovations that allow doctors to treat some high-risk heart-related ailments that were once, considered to be untreatable?
Yeah, that is a very broad question to be answered actually, because cardiology is advancing like on a very rapid scale, and I think I will talk about which is more interest for the general public. Like I'm not going to talk about the congenital heart disease or structural heart disease like your valve therapies and all this. A lot of advances are there, but regarding a population health perspective, heart disease generally means the heart attack, the blocks you are having, and those things I will just have a idea about what are the latest advances. Earlier, when there are diffuse blockages, multiple blocks, larger number and length of blocks are there. So the only option used to be bypass, and in some cases, bypass surgery was also not feasible due to the general health of the patient or some thing like the pumping failure of the heart, all those things. But now there are solutions to almost all of these, like whether if the patient is having some kidney failure, patient is having very low ejection fraction or pumping is very low, age is very advanced, he has very advanced calcification in the vessels, which makes routine angioplasty procedures a little bit difficult. There is an entire faculty of medicine or entire subspecialty of not subspecialty, but a specialization of cardiology which deals with this. It's called CHIP, angioplasties and complex high risk indicated procedures, where we deal with these kind of blocks. So mainly there are a few advances I will tell. There is something called intravascular imaging, wherein you go inside the coronary arteries and see exactly what is the pathology, how much is the calcium extent, what is the size of the vessel, like intravascular ultrasound, OCT, those things are available, which adds to the precision of the treatment that we deliver. Next thing is the major hurdle is always the chunk of calcium which gets deposited in the vessels, which makes the treatment very difficult. So we now have a lot of modalities to treat this calcium or break this calcium. Like we have the rotational latherectomy or latherectomy, intravascular lithotripsy, the laser angioplasty. All these are available. Then for treating some like bifurcation, small vessels diseases, which were earlier very difficult to treat with stents, now we have the drug-coated balloons. So where there is no metal, but almost the similar effects of a stent we can do without a metal. So that is also available. Then regarding patients who have kidney disease, we have very low contrast or nil contrast angioplasties which are available now. And similarly, patients who have very low ejection fraction or low pumping, we have devices to augment the pumping, like the Impella, APP, which that's called hemodynamically supported angioplasties. This can be done.
Also, is it true that intermittent fasting, is linked to heart issues that are happening in the recent days? Because there's a lot of talk about, how intermittent fasting is actually affecting the health. Is it a myth or is it true?
Regarding the dietary interventions in heart health, there are a lot of controversies. Many of the things are not just white and black. There are a lot of gray areas in that. So one thing is we don't have definite data about whether to say it's good or bad, intermittent fasting. But in general, periods of fasting, longer periods of fasting is good for health. But in a patient with heart disease, and particularly if he's diabetes, episodes of hypoglycemia can even precipitate coronary events. Like you can have a heart attack due to a hypoglycemia event itself. So that in a person who has already developed heart disease and is having a heart blockage and all, we don't recommend very tight control of sugar and all that. Average control of sugar is fine. But if you just take in the general population perspective, longer periods of fasting are considered to be good for overall health. But we don't have any hard data to tell that this diet is good or bad like that. But general, the Mediterranean diet, the DASH diet, the so-called, where we have a lot of data, where there is a lot of fresh vegetables and fruits in the diets, like more of poultry and fish is there, the diet, rather than the red. Those are all, we have some evidence that these are all good for heart. But for intermittent fasting, keto dieting, all those, we don't have any hard data to them.
What are some of the simple everyday lifestyle changes, whether in diet, exercise, or stress management techniques that can go a long way in protecting heart health?
Diet, one thing we know for sure. I will just say what we know for sure, not about the other gray areas I will not touch. But generally, as we used to tell earlier, all the saturated fats, the processed foods, and now we add to that the refined sugars. The refined sugars are really bad for your heart health as well as your overall general health. Added sugars should be avoided even for non-diabetic people. Sugar is not an essential thing in your diet that we should understand. We are just taking it for the taste of it. There is no additional nutritional value we are receiving from it. And salt has to be respected. All processed food has to be respected. Get more fresh fruits and freshly prepared diet. And always more of steamed and boiled food are more healthy than the deep fried food items. Then second thing is get going, get moving. We all have an epidemic of obesity happening around us, and one of the reasons is our job is mostly we are all static, sitting for long periods. So sitting for additional 1 to 2 hours a day significantly affects your heart health actually. So get moving. We all have this gadgets nowadays which can be used to count the steps and everything. Those are all kind of motivation where you can get going. So have some kind of an exercise, at least 30 minutes per day, an average intensity exercise 5 days a week, and if possible 2 days if you have some weight training or something like that. It's very good. So that is regarding the diet and health. Then other things like work stress, your sleep pattern. To what extent you can modify that? You have to decide that how much stressful your work is and how can you take care of that. And if get to have a proper sleep pattern, at least 6 to 8 hours per day. It might be too much, but at least 6 to 7 hours per day of quality, not just the quantity. Quality sleep is very important. So these are all some small things that we can do uh, to get our heart health all okay.
Great. Thank you, doctor. Thank you so much for talking to us.
Thank